Good evening, dear viewers, and welcome to another episode of Medical Talk, your trusted window into the world of modern medicine and health awareness. Today, we address a condition that affects many families and children around the world. Nocturnal enuresis, commonly known as bedwetting, also often seen as a simple childhood phase, bedwetting can place emotional stress on children and parents alike. Understanding the causes, available treatments, and proper ways of support is essential to overcoming this challenge. To shed light on this important topic, we are honored to have with us Ms. Eman Ahmed, specialist in child behavior and pediatric health. Together, we will explore why bedwetting occurs and it becomes a concern and how families can help their children overcome it with confidence and understanding. Stay tuned, you are watching Medical Talk. Welcome back. We're happy to have with us in the studio Dr. Eman Ahmed. Dr. Eman is a specialist in child behavior and pediatric health. Welcome to Medical Talk, Dr.
Thank you very much.
Thank you so much.
Thank you for inviting me for this.
It's a very, very interesting topic. Yeah. I'm sure our audience also have many questions.
Yeah, thank you.
Especially the mothers and the parents. But to begin with the basics, how do you medically define nocturnal enuresis? And when do you consider it a condition that requires intervention?
Okay, for nocturnal enuresis, we can divide it into two types, primary and secondary. The primary one, usually the child never had dry nights and he reached like 4 to 7 years. Mostly we say 6 years. So this is primary one.
Okay.
The secondary one, they have previously dry nights, months or years. Then suddenly he starts bedwetting. So this is the secondary one.
Okay. So regardless of the age, you mean?
Yeah, regardless of the age.
It could be younger, it could be older?
Mostly after 6 years.
Okay.
Yeah.
So usually the child after 6 years should have a dry night, basically.
Yeah, should, yeah.
Okay. So what are the most common causes of bedwetting in children, and do these causes differ from one child to another?
Yeah. So if we start with the secondary causes, usually we can divide it into organic and non-organic. So the organic one, we have to search for like diabetes mellitus, urinary tract infection, even constipation can cause enuresis because of the pressure on the bladder. The other thing, even the adenoid and the tonsil, if it is enlarged, and the sleep apnea, they will have secondary enuresis. This is the organic one. The non-organic one, psychological. So we have to see whether the child has problem at school, bullying, problem at home. These all lead to secondary enuresis.
I see.
For the primary one,
yes,
either the child genetically, neurologically abnormal from birth, and he will continue like that, or it can be like familial. So if he has family history, like genetic family history of enuresis, like if one of his parents has enuresis, the chance of having enuresis is about 44%.
That's a high percentage.
High.
Yeah.
If both parents, it can reach to 77%.
So you asked the parents during the consultation whether anyone had this problem when they were kids?
Problem when they were children.
Okay.
Yeah, yeah.
And it doesn't matter if the parents have like a secondary or a primary. Is it necessary to be the same for the child?
Like mostly primary.
Okay.
Yeah, mostly. Yeah.
Okay. So
and other causes like the functional one, either small bladder, easily contractible, or deep sleep, difficult to arouse, or the antidiuretic hormone coming from the brain, either low in level or the bladder is not sensitive to that hormone.
Exactly.
So these can be.
I'm going to circle back. I'm going to go back to the keys and the indicators basically for that condition. But there is a common belief that bedwetting is basically comes from simply laziness, or it's like a habit for the child.
Yeah.
How accurate is this conception?
This is not accurate at all, and this is not habit. So as we said, even like the primary one, especially, either they have family history or they have these conditions. We mentioned the 3-1, the bladder and the antidiuretic hormone and the deep sleep. We can work on these three, and we will reach to a good result and resolve the problem.
I see.
Yeah.
You mentioned before that if one of the parents had this problem, there's the more chances that the child will have a problem. So, and you also mentioned about psychology. I want to break this question into two parts. So, is there a genetic component to it?
Not like genetic, but familial.
Okay. So there
like,
is
no special genes.
They haven't identified a special genes.
Yeah,
that
no special gene.
Okay.
But familial.
Okay.
Like when you have multifactorial, multifactorial things.
I understand.
Yeah.
And in terms of psychology, you mentioned earlier bullying and stress and family problems.
Family problems.
Like what is the most psychological indicator that this child could end up bedwetting?
Usually we have to exclude the organic part. And if we reached all of that is normal, we have to think about the psychology. Then we can do interview with the parents, with the child, and mostly we reach to a problem. Especially the bullying. Now 95% of the children at school, they are bullied.
Yes.
And some children, they will have this problem because of the bullying.
So it's a big factor.
A big factor, yeah.
Mostly the most common denominator, the common factor between
the secondary
part. That's good. Now, at what point should parents seek medical evaluation? And are there any warning signs that indicates the needs of further assistance?
Yeah. Usually with the secondary, we have to be very alerted. Like if they are dry before and suddenly they start bedwetting, we have to think seriously about it. Because if it is diabetes or urinary tract infection, so we have to seek medical advice and see why. Any organic thing we can treat. So this is very important.
Yeah.
And with the primary one, if the child reach, as we said, 6 years of age, and he's still bedwetting, we have to seek medical advice, not to wait and see, maybe later or whatever.
Yeah, I see. Yeah. So is there a point that this condition could actually precipitate to worse, basically, phases in the patient's life?
Of course, some I have seen children like 15 or 16, and they are still bedwetting. And parents, they just maybe with time, but no, this is not normal, and we have to work on it early.
Yeah. Is it possible that this thing could actually continue with you until your adulthood?
Sometimes they reach to 18 and they are bedwetting.
Okay.
And they are married and bedwetting.
Okay, so if left untreated or unattended, this could actually cause a problem.
We have to work on it.
Okay, we have more questions, but we have to take a short break. There is a report we're going to watch, and then we'll be right back. Stay with us. Welcome back. We're still talking in the studio with Dr. Eman Wetwet. Dr. Eman, before the break, we were talking about at some point, as you know, that parents should pay attention to this condition, not neglect it. Otherwise, it will precipitate into a serious problem. As we mentioned before the break, this could actually last for a long time.
Later,
I mean, until adulthood.
Yeah.
What types of tests or evaluations are necessary to determine the underlying causes of bedwetting in children?
Yeah. So mainly the secondary one, we have to do blood tests for like diabetes mellitus, urinary tract infection, urine test, urine culture.
To exclude all these.
To exclude all of that. X-ray for adenoid and nasopharynx, and ultrasound abdomen for if they have constipation. So exclude all of the organic problems. If it is like mainly the primary nocturnal enuresis, we have certain clinics in UK, we call it nocturnal enuresis clinic. Usually the consultation, it takes 1 hour or more, like just to explain more and discuss with the parents what we have to do, the steps. So usually what we advise, and the child himself has to sit and listen. So
to be involved in the discussion.
To be involved, because he can understand.
Yeah.
So regarding like small bladder, like what to do, We advise parents and the child to drink as much as he can during the day and go to the toilet again and again every hour, every 2 hours. Why we are doing that? This is just to train the bladder to be strong, like dilate, contract, dilate, contract. Look like we are doing physiotherapy for the bladder to be more strong and can accommodate more urine.
Yes.
This is during the day. At night, we have to be like 2 hours before bed, they have to stop taking any liquid. We don't advise about fizzy drink or sugary drink. Even if he feels thirsty, sips of water is enough.
Yeah.
So this is 2 hours before bed. For example, if he slept at 9. So usually we have enuresis alarm. If we have the enuresis, which is different type, one with sensor, one with the wire and one wireless. In UK we have it. In here I think is difficult to get. So the enuresis alarm with the first drop, because there is a sensor in the pant, we can't put it. First drop, it will alarm. Then the child will wake up, go toilet, and with time, the link between the brain and the bladder start working. If we don't have this alarm, what I will advise my patient? I will advise parents to be the alarm of that child.
Okay.
For example, he slept at 9, so they have to go and wake him up at 11 or 12
to go to the bath.
To go to the bath.
Yeah.
But I will advise not to hold the child and put him on the toilet. Look like we are doing nothing.
Yeah.
He has to be awake, go by himself and sit on the toilet and come back. So we need that link to work.
Yeah, they need to be aware.
Aware, yeah. Usually, like we said, 12, 3 o'clock, and then like...
every 2-3 hours, basically, they have to wake up.
It will be hard for the parents, but it works very well. It takes 2 weeks to 1 month, then that link starts working.
Okay. So yeah, go ahead. I'm sorry, go ahead.
So this is like during the day, during the night. The reward system with the child work very well, very well. So if he listened to everything and he did whatever we want from him, and he wake up dry, so he has to have points, like gift point, star points,
positive reinforcement.
5 or 10, he has to have a gift. And I advise not to buy the gift for every sibling.
No,
it has to be only for
unique
him
and
to
special.
feel that he did something
achieved
good.
something. Yeah, absolutely.
This is one. The reward system work very well.
Yeah.
The other thing, if he, even with that, he passed urine. So in the morning, he has to feel the responsibility, not to walk away and leave mom do whatever. So he has to help her change the sheet,
clean for himself,
clean himself, take the sheet to the washing machine, change the bed. That feeling of responsibility also works very well.
Yeah.
Usually, this kind of guidelines, it works very well within 2 weeks to 1 month. And most of my patients, they don't reach to medication. If they follow this strictly, they will be very good.
I'm glad that you mentioned medication, because a lot of people, they know or they don't know that there are some treatments available for this type of condition. What are the most treatment options available today? And like you mentioned about behavioral management. Let's talk about medical treatment, basically.
If that failed, we have to go to medical treatment. The medication we use, we call it desmopressin, which is the synthetic component of the antidiuretic hormone. So usually it has certain concentration. We used it for 2 weeks to 1 month. We increase or decrease the dosage. Then it works. But sometimes, sadly, when you stop it,
it comes back again.
It comes back. So I prefer to advise and do the steps we mentioned before better than go to medication. Sometimes even that medication fail, which is rare, but it can happen. So we have to go to anticholinergic or antidepressant, which is we don't like it for
We don't
children.
recommend that. Yeah, exactly.
Yeah. But mostly the steps we mentioned, it helps very well.
I think you mentioned earlier that first of all we have to dissect the root cause of the problem. If it's psychology, if it's something organic, you know, understand the real what's happening, the real cause what's happening, and then we build on that.
Yeah.
And it seems to me, I mean, correct me if I'm wrong, that the first line of defense or approach is behavior.
Yeah.
And then
mostly.
we go to pharmacology, basically.
Yeah, that's very right. Especially with the primary cause.
Exactly. And the time frame we're talking about for this is like
the response within 2 weeks to 1 month, my patient, they come very happy.
It's very satisfying, very rewarding.
Yeah. Like I have one patient, he told his dad in front of me, if I didn't pass and I listen 1 kd in the morning, he said, yes, that's fine. 1 kg from the first day.
So he's rich now, basically.
Yeah. So it can be the reward system works very well.
It's amazing. The positive reinforcement actually does work. I can tell you from my own field as well. Can lifestyle adjustment or dietary habits help reduce nighttime episodes?
Yeah. As we said, like to avoid fizzy drinks, sugary drinks, especially before bed, it helps a lot. And during the day, the same steps we said, like drinking a lot of water or like normal juices or something to train the bladder. If the child used to sit on TV or iPad, or then leave it to the last minute and he didn't change the style of like his daily routine, this is very bad.
Yes. Now, is it possible that sometimes after a successful treatment mission, basically, that it could happen like once in a lifetime, basically the child will suddenly go back and have it's not a relapse, I would say, but they might have an accident. What do you tell the parents at that time if they face one incident?
Yeah, one incident is fine. Like especially if the child
tired
or sometimes they are ill or feverish or something, it can be acceptable.
Yeah. Because the reason I'm telling you this is because it could happen, and sometimes it just put you back.
They will feel bad,
and they put you back to the first square. I know a case. I know for sure that they were doing very well, and after maybe 1 year of dry nights, suddenly the kid came back and started, and because again he was tired or having a fever, and it's just clicked immediately, and they start having this bedwetting and they had to go back to the same health therapy and then do the cycle again.
Usually it doesn't lead to the 0 point. Usually once in a while it's fine.
What do you see the future for treating this condition?
Behavior. I don't believe to directly go to medication without starting with the behavior, because with my patient I have seen a lot. They respond very well, very, very well, and they come very happy.
I see.
Yeah.
Well, one last question. Do you see this condition more with boys or girls?
I think boys mostly.
Mostly.
Yeah. I don't know why.
We don't know why. Part of my research for this episode,
maybe because the boys ignorant or something.
No, I mean I was trying to link it to the urology aspect of it, okay, because they have a different system, okay, between male and female. But interestingly, there isn't. I haven't seen any in the literature an explanation why is it more prevalent for males than females. And you know, it's one of those things, and I guess we will have to wait for the research to give us more answers.
Studies or something.
Exactly. But thank you so much for all your work and all the insight that you shared with us. Unfortunately, that's all the time we have.
Thank you.
Hopefully we'll be able to host you again in Medical Talk. Thank you so much for your time.
Thank you very much. Thank you. Really appreciate it.
Thank you so much. Dear viewers, we still have more to go, but stay with us. We'll be right back. Dear viewers, before we move on to our family health tips, let's remember that good health always starts at home. Parents play a key role in teaching their children how to eat well, stay active, and care for their bodies. Health education isn't just advice anymore, it's a way of life that helps every family stay stronger and healthy. Let's watch it together.
Hello everyone. You might have noticed some children who suddenly refuse to go to school or avoid their friends or seems unusually quiet. So behind their silence, there might be something painful happening. So bullying. Today we'll be talking about bullying and its emotional impact in children. So bullying is not just the playful teasing. So when a child or group of children, they intentionally and repeatedly hurts another child, may it be through their actions or through their behaviors. There are different types of bullying, like physical bullying, where the child hits or beats or pushes another child, or verbal bullying, like name calling or mocking or insulting. It can even be social, like leaving out a child from the group on purpose, or like spreading rumors about the children. And the most common one nowadays is a cyberbullying. Your social media is always on your fingertips, so bullying is even possible with a small click on your phone. Mean comments, rude comments, the reactions which hurt the feeling of others. The impact or the effect of bullying on children, it goes deeper than that we can imagine. So a child who has been bullied, present with low grades at school or like low confidence, so they might be having feelings of anxiety, loneliness, or helplessness. Some children, they present with constant fear, so they might refuse to go to school because every day seems to be like unsafe for them. So sometimes over time, this emotional pain, it can lead to depression and self-harm ideas in some children. The most dangerous thing is that some children, they do not speak about it, may it be due to the shame or due to the fear. So as parents or as teachers or as friends, we should notice the warning signs in them. Talk openly about bullying, give emotional support to your child, and teach them kindness. So this can bring about a world of change. So every child, they deserve to be feel safe, and we should start teaching our children not just to be smart but also to be kind. Thank you.
As we conclude this episode, we remind our viewers that bedwetting is a common condition, and with understanding, patience, and proper guidance, every child can overcome it. Supporting our children with compassion is the first step toward confidence, healing, and healthier futures. Thank you for watching Medical Talk. See you next time. Until next time, please stay safe and stay healthy.